Bismillahirrahmanirrahim. Assalamu alaikum dear students. I hope you all are fine. Today our topic of discussion is lymphatic drainage of head and neck. So for the descriptive purpose, we divide the lymphatic drainage of head and neck into three groups. The superficial group of cervical lymph nodes, deep group of cervical lymph nodes, and deepest group of cervical lymph nodes. First of all, we will discuss the superficial group of cervical lymph nodes. The superficial group of cervical lymph nodes include buccal and mandibular nodes, preauricular and postauricular nodes, occipital nodes, and superficial cervical lymph nodes having anterior and lateral groups. So, the buccal lymph nodes, as the name indicates, these are present on buccinator, and the mandibular lymph nodes are present at the lower border of mandible, close to the mandibular branch of facial nerve, and these nodes drain part of cheek and lower eyelid. Then we have preauricular lymph nodes. They are located in front of ear and they drain parotid gland, temporal region, and middle ear. Then we have postauricular lymph nodes. These are also known as mastoid lymph nodes, and they are present on the mastoid process, and they drain a strip of scalp just above and behind the auricle, upper half of the medial surface of auricle and posterior wall of external acoustic meatus. Then we have another group of superficial cervical lymph nodes, that is occipital lymph nodes. This group of lymph nodes is present at the apex of posterior triangle, and occipital nodes drain the occipital region of scalp. Then we have anterior superficial cervical lymph nodes. They are present along the anterior jugular vein, and suprasternal lymph node is a part of this anterior superficial cervical lymph node group, and this group drains skin of the anterior part of neck below the hyoid bone. Then we have the last group of superficial cervical lymph nodes, which is called lateral superficial cervical nodes, and it is present along the external jugular vein, and it drains lobule of auricle, floor of external acoustic meatus, skin over the lower parotid region, and angle of jaw. The efferent fibers of all these lymph nodes then pass to the deep cervical lymph nodes. Now the same thing is shown in this diagram. You can see these are buccal nodes which are present on the surface of buccinator muscle. Then we have these parotid lymph nodes or the preauricular lymph nodes which are present anterior to the auricle. This is external acoustic meatus. So these parotid and preauricular lymph nodes, they are present anterior to the auricle. Then we have this group which is called retroauricular or posterior auricular lymph nodes, and this group is called occipital group of lymph nodes, which is basically present at the apex of this posterior triangle where the sternocleidomastoid and trapezius muscle meet each other. So it is present at the apex of this posterior triangle. So these are the groups of superficial cervical lymph nodes which drain a part of head and neck. And now we will discuss the deep group of cervical lymph nodes. Now the deep group of cervical lymph nodes include submental and submandibular lymph nodes, and lateral group of lymph nodes which are present around the internal jugular vein, and they are having upper, middle, and lower groups. So upper lateral group, middle, and the lower lateral group which is present around the internal jugular vein. And then we have lymph nodes of the posterior triangle in the deep group of cervical lymph nodes. So submental and submental lymph nodes, they lie deep to the chin, and they drain tip of tongue and anterior part of floor of mouth, while the submandibular lymph nodes, they drain the central area of forehead, lateral surface of tongue, and lower gums and teeth. Then the upper lateral group around the internal jugular vein, it is located below the posterior belly of digastric muscle between the angle of mandible and sternocleidomastoid muscle. And jugular-digastric lymph nodes, they are a member of this upper lateral group around the internal jugular vein, and this is the main group that drains tonsils. Then we have middle lateral group around the internal jugular vein. This group drains thyroid and parathyroid gland. The middle lateral group receives efferents from the prelaryngeal, pretracheal and paratracheal lymph nodes. These are the lymph nodes of deepest group of cervical lymph nodes. Then we have a lower lateral group around the internal jugular vein. It is having a group of lymph nodes which is called jugulo-omohyoid lymph nodes, and these are present just above the intermediate tendon of omohyoid muscle under the posterior border of sternocleidomastoid, and this group is the this group drains the part of, this is the main lymph node of tongue basically. Then we have the lymph nodes in the posterior triangle. Now the efferents of all these deep cervical lymph nodes, they join together to form the jugular lymph trunks on each side. Now on the left side, the left trunk opens into the thoracic duct, while the right trunk opens into right lymphatic duct, or at the angle of junction between the internal jugular and subclavian veins. In this diagram you can see that this is internal jugular vein, and these are the nodes which are present around the internal jugular vein, including upper, middle and the lower lateral group of lymph nodes around the internal jugular vein. And these three nodes they drain tonsils, thyroid, parathyroid and tongue. So these lymph nodes which are present around the internal jugular vein, they basically drain 3 T's, that is tonsils, thyroid, parathyroid and tongue. Now comes the third and the last group of cervical lymph nodes, that is the deepest group of cervical lymph nodes. The deepest group of cervical lymph nodes includes prelaryngeal and pretracheal nodes, paratracheal nodes and retropharyngeal lymph nodes. These lie deep to the investing layer of deep cervical fascia, and the prelaryngeal nodes, they are present on the cricothyroid membrane, while the pretracheal nodes, as the name indicates, they are present in front of the trachea just below the isthmus of thyroid gland, and these nodes drain larynx, trachea and isthmus of thyroid gland. Then we have another group which is paratracheal lymph nodes. As the name indicates, this group of lymph nodes is present on the sides of trachea and esophagus along with the recurrent laryngeal nerve, and these nodes drain trachea, larynx and esophagus. Then we have a retropharyngeal group of lymph nodes. It is present in front of prevertebral fascia and behind the buccopharyngeal fascia, and this group of lymph nodes drain pharynx, auditory tube, soft palate and posterior part of hard palate and nose. This diagram shows all the 3 groups of cervical lymph nodes. First of all, we will see the superficial group of cervical lymph nodes. You can see this is a group of, this is a lymph node which is called buccal lymph node, and it is present on the buccinator muscle. Then you can see this is a lymph node which is called mandibular lymph node. Then we have here posterior auricular lymph nodes, or we can say them mastoid lymph nodes. Then at the apex of posterior triangle we have these lymph nodes which are called occipital nodes. Then these are the superficial cervical lymph nodes. These all lymph nodes are they come under the heading of superficial cervical lymph nodes. Then we have the deep group of cervical lymph nodes. Here you can see these nodes which are very tiny. They are called submandibular lymph nodes. These submental lymph nodes which are present just beneath the chin, these are submental lymph nodes. Then we have this internal jugular vein, and this internal jugular vein is having the upper, middle and the lower lateral group of cervical lymph nodes around it. Then you can see we have the lymph nodes of deepest group of cervical lymph nodes, which are present here in front of larynx and in front of trachea. So these are prelaryngeal and pretracheal lymph nodes. Then there are some nodes which are present around the trachea. They are called paratracheal lymph nodes. So these are the three groups of cervical lymph nodes, that is superficial, deep and deepest group of cervical lymph nodes which drain head and neck. Up till now we are done with the cervical lymph nodes. Now comes thoracic duct. Thoracic duct is the largest lymph trunk of the body. It begins in the abdomen from the upper end of cisterna chyli. This is cisterna chyli, and from its upper end thoracic duct begins. Then it traverses a thorax, and it then opens at an angle present between the left internal jugular vein and left subclavian vein at the level of C7 vertebra, and at the level of transverse process of C7 vertebra, this thoracic duct, it shows an arch. You can see this is the arch, and this arch is present 3 to 4 centimeter above the clavicle. So this thoracic duct, it begins from the upper end of the cisterna chyli and ends at an angle between the left internal jugular vein and left subclavian vein. Now the arch of thoracic duct, which is formed at the level of transverse process of C7 vertebra, it relates anteriorly to the left common carotid artery, vagus nerve and internal jugular vein. Note that these are the three structures which lie inside the carotid sheath. Then posteriorly, the arch of thoracic duct is related to the vertebral artery, phrenic nerve, scalenus anterior muscle, prevertebral fascia, thyrocervical trunk and sympathetic trunk. These are the posterior relations of arch of thoracic duct. Apart from the tributaries of thoracic duct in the abdomen and thorax, in neck, the thoracic duct receives left jugular lymph trunk, left subclavian lymph trunk and left bronchomediastinal lymph trunk. You can see this is cisterna chyli and this is a thoracic duct which is opening here at this angle, and it here in the neck it receives three tributaries. This one is left jugular lymph trunk, then left subclavian lymph trunk, and this one is left bronchomediastinal lymph trunk. These three are the tributaries of thoracic duct in neck. Cervical lymphadenopathy. This is the enlargement of cervical lymph nodes. The causes of cervical lymphadenopathy, they may be inflammation, any infection like bronchitis, common cold, ear infection, any scalp infection or tonsillitis. It can cause cervical lymphadenopathy. Then there may be any malignant cause. The deep cervical lymph nodes that lie around the internal jugular vein, when they are enlarged, in case of any malignancy or TB, they become adherent to the internal jugular vein. Therefore, the internal jugular vein is also resected along the nodes in such cases. As you all know that the jugulo-digastric lymph nodes are the nodes that drain the tonsils. So, the chronic infection of palatine tonsils, it can also cause the enlargement of jugulo-digastric lymph nodes. Similarly, infection in tongue, mouth and cheeks, it also causes the painful enlargement of submandibular lymph nodes. And when the lymph nodes of posterior triangle, they are enlarged, then the spinal root of accessory nerve, it may get entangled in this enlargement. So, while taking biopsy from these lymph nodes present in the posterior triangle, one must be very careful not to injure the accessory nerve. Then Virchow lymph nodes, the left supraclavicular lymph nodes, they are called Virchow's lymph nodes, and any cancer from the stomach and the testes, it can metastasize into these lymph nodes. In this diagram, you can see the common causes of cervical lymphadenopathy. So that is all for today. Thank you so much for listening.